Hello, my name's Stephanie. I'm the Women's Health Physiotherapist at the Trust, and I'm here to provide you with some advice and information about how you can recover after your caesarean section. We're going to talk a little bit about different positions and postures, different exercises, and sort of stages of when you can and can't do things. Okay. So I'm going to start off just by talking a little bit about resting positions. So obviously when you have your caesarean, you're going to be in quite a lot of pain. It is quite major surgery, but the good thing is you know you're going to have it, you're expecting it. Okay. So after you've had your caesarean, you're going to be asked to get up and about. Okay, they're not going to just let you lie in the bed, and you're not going to want to just lie there. So in that first day after surgery, it's a good idea to get out of the bed and get your muscles and everything moving. So I'm going to show you the best way to get in and out of the bed. Okay. So if you're lying in the bed and you're lying on your back, you'll be in this position. Okay. Now you're going to have a wound down here, which is going to be quite sore. Okay. Your tummy muscles are going to generally feel quite sore where you've had the surgery. So you don't want to get in and out of the bed pulling up like this, because that's going to cause more problems. So what we need you to do is to roll onto your side. So you're going to be back in this position, okay? Now the best thing to do is to bend the outside leg up. Think about looking the way you want to go and using your arm to help you. Now you can support your wound with just your hand, or you can use a towel or a pillow to help. So with the towel, you can just pop that near to your wound and give yourself a little bit of compression. Then you reach the way you want to go and turn your head, and then you'll come over onto your side. Okay. Now from this position, this is where you can get out of the bed. So you're going to bring your legs forwards, and you're going to use this hand to push up into the sitting position. And now you're sat upright. Now you just need to shuffle yourself forwards to the edge of the bed and then push up through your hands. And then you're in standing position. When it comes to getting back into the bed, you're going to do the opposite. So you'd be sitting on the edge of the bed. Okay. Again, you can use your towel, you can use a cushion, just where your wound is. And you're first of all going to lower yourself onto the side. So you use your outside hand, you bring your legs up, and you come into a side lying position. Then you're going to straighten this leg and then turn yourself onto your back. Now the beds in the hospital quite handily move up and down with a controller. Unfortunately, you're probably unlikely to have that at home, and I don't have that here, but you can use that to elevate yourself slightly. So after you've had your caesarean section, you're going to be less active than you were previously. So it's really important that you get enough oxygen into your lungs, because you don't want to develop any chest infections. So for that first initial day post-surgery, you're going to be much less active. So it's really important that you take some nice big deep breaths. So what you're going to do is every hour or two, you're going to take a nice big deep breath in through your nose and then out through your mouth. Okay, it's really important that you breathe from down here rather than up here, because that'll get lots of oxygen into the bases of your lungs. Okay. You're also going to be less active in your legs, so you want to make sure that you keep your muscles nice and strong, and you don't want to pick up anything like a DVT, so you've got to keep your ankles nice and mobile. So if you're sitting in the chair or you're lying in the bed, you can do some ankle pumps. So just looking at your leg, just bringing your toes up towards you, and then pointing your toes down towards the floor. I recommend doing 10 pumps up and down on each leg every 1 to 2 hours. The other thing you can do, if you're lying in your bed, you can practice just bringing your foot towards your bottom and then sliding back down. And that will just get your knees moving a little bit. And if you're sitting in the chair, you can just slide your ankle away and then back towards you, just to get your knees bending, and that just enables you to have a bit more movement. If you are sitting a lot, you want to make sure you're resting in comfortable positions. There's various comfortable positions for you. If you're lying, you're probably best lying on your side. And again, you may use your towel, which will provide a little bit of support for where your wound is. You may also have a towel or a pillow between your legs, and that will just keep you in a nice neutral position. We recommend that whenever your baby's resting, you should be resting, because that way you're going to get enough rest when they're not around and needing you to provide assistance for feeding, changing. Okay. It's important not to do too much when you're home with baby, so try and limit how many times a day you're walking up and down the stairs. We do want you to do some exercise, and we recommend taking short walks on a daily basis or maybe every other day. The first time you go out, have somebody with you so you're not going out alone, and just go a very short distance, 5 minutes maximum, and then each day, depending on how you feel, you can gradually start to increase your distance. Remember, you've got to get back, so don't walk so far and then struggle to come back. It's also really important that you have lots of coughs when you're less mobile, because again, you want to make sure you don't get any chest infections. So when you're in the hospital and the days afterwards, try and take nice big coughs every couple of hours. Okay, it might be quite painful to cough, so you might be thinking, I won't cough, but it's very important that you do. To help with that pain, you can again use your towel. Okay, so if you feel you're going to laugh or cough or feel a sneeze coming, you can use compression. So you can get your towel or a pillow or just a clean hand over your wound, and you can just push against it and then have a nice big cough as you compress. So in order to look after our stomach muscles and our back after the cesarean, there's a number of exercises we can do to help strengthen the tummy muscles up, which will then help to strengthen your back. So when you've had your cesarean, you can start these on the first day afterwards. You might not feel up to it at that point, but you're definitely allowed to, and it's good to start them as soon as possible. These exercises can be done mostly in lying, but you don't have to be in lying to perform them, so I'll demonstrate them in lying today. What we want you doing is we want you gently drawing in these lower tummy muscles, just to start to strengthen those tummy muscles up a little bit. So what we need you to do, we need you to work on drawing your lower tummy muscles in. So thinking about your belly button and below, and gently tightening that area. So I'm going to get you to breathe normally. You're going to breathe gently in through your nose and gently out through your mouth. As you breathe in, you're not going to contract any muscles. You're going to stay nice and relaxed. You're going to do the action as you breathe out. So we're going to breathe in and stay nice and relaxed. And then as I breathe out, I'm going to gently draw in these lower tummy muscles, belly button and below, towards my spine. Now it doesn't look like I'm doing very much, but I've got some tightening happening down here. Now I'm breathing still, but I'm holding on to that contraction. And then I'm going to let go. It's a good idea to start holding it for a couple of seconds and build the hold time up to about 10 seconds. So that's your first exercise. So it's quite nice to do in lying, but you can do that in any position, from sitting to standing to being on all fours to side lying. The next exercise we're going to do is similar. We need to set those muscles just as I did. So you're going to do your breathing in. As you breathe out, you're going to draw in your tummy muscles, and then you're going to gently let your knees just drop down to one side while keeping this nice and tight, and then bring them back up to the middle, keeping my stomach muscles drawn in, and then rolling down to the other side, and then back to the middle. Now you don't want to take your legs too far that you're really twisting. It's just a nice gentle movement just to get the back used to that mobility. And you're looking to do between 5 and 10 to each side, about 2 or 3 times a day. The last one you're going to do is some pelvic tilting. Now again, you don't have to lie down for this exercise. You can do it in sitting, standing or lying, but it's quite nice to start it in lying. So you're lying with your knees bent, and all you're going to do is you're going to rock your pelvis so that you gently tilt, push the small of your back down into the bed, curl your bottom up slightly, but not actually lifting your bottom, and then gently roll the other way so you're arching your back slightly. So this is a very gentle, subtle movement, just a gentle tilt, all from the stomach muscles. Again, you're going to do between 5 and 10 of those, between 2 and 3 times a day. One of the most important exercises we need to do after we've had a baby, whether it be a normal delivery or a cesarean, is pelvic floor exercises. Now, the pelvic floor muscle is a sling of muscle which sits on the floor of your pelvis from your pubic bone at the front to your tailbone or your coccyx at the back. It's a very important set of muscles because it supports the pelvic organs within, it controls the continence mechanism for your bladder and your bowel, it has a sexual function, it gives you sensation during intercourse, and it helps to support your pelvic joints. So it's really important that these muscles are strong. But by carrying a baby for 9 months, those muscles become weaker, and obviously if you've had a normal delivery, you will overstretch the muscles. Now, you ladies have had a caesarean section. That doesn't mean you've got away without weakening those muscles. Your stomach muscles will be weaker, and that will in turn cause weakness with your pelvic floor muscle. So it's really important that we all strengthen our pelvic floor muscles. Now, the best way to strengthen your pelvic floor muscles is from the back passage round to the front passage, but doing it all as one. So I want you all to have a little go now. I want you to imagine you've got some wind in your bowel, but you don't want to pass it because you're in a room full of people. So what you're going to think about is you're going to think about your back passage, that little ring of muscle, your sphincter muscle, and I want you to think about tightening that muscle. You're going to squeeze and lift your back passage. Now, you should feel a lifting internally. No one should see you doing anything. You shouldn't be squeezing your bicep muscles and bobbing up and down because that will just give you a nice toned bottom. What we need to be doing is working the muscles within. So that's your starting point. You're going to think about drawing in your back passage. Now, as you do that, I also want you to think about pulling around the front. So I want you to imagine you need to pass water, but you're trying to stop yourself. So you're going to start at your back passage, you're going to squeeze and lift, and as you do that, you're going to pull around the front to imagine you're trying to stop yourself passing water. You should feel the muscle lifting forwards and up from the back to the front, and that is pelvic floor exercises. Now, when we strengthen our muscles, we need to do them in 2 ways. We need to do the action of squeezing and lifting from the back to the front, and then letting go. And we need to do that same action where we squeeze and lift from the back to the front and we hold. With the hold, start with a couple of seconds. So pull up, squeeze, hold, count to 2 and then let go. As your muscles get stronger, you'll be able to hold for longer, working up towards 10 seconds. And what you need to do is you need to do a number of repetitions in a row. So start low, 2 to 3 second hold, maybe 5 or 6 repetitions, and as you get better you're working towards doing 10-second holds. For our fast contractions, we're just going to pull up and let go, and you're aiming to do 10 of those in a row. So you've got 2 sets, you've got fast contractions and you've got holds, and you're looking to do each of those between 3 and 6 times a day. So it sounds like quite a lot, but it's a secret exercise. No one needs to know you're doing it. And you can do it while you're feeding your baby, you can do it while you're having a cup of tea, you could do it while you're at the red traffic lights. It's really up to you, but you need to bring it into your routine. It's a great idea to start now while you're pregnant and then carry this on after you've had the baby. Now, pelvic floor exercises are for life. You don't necessarily have to do them 3 to 6 times a day for the rest of your life, but you're going to want to be doing them at least daily for the rest of your life. And for the first 6 months after pregnancy, I'd do them that 3 to 6 times a day if I could. A lot of people talk about stopping their urine mid-flow and think that's how they strengthen their pelvic floor. We advise you not to take that option. It's okay to do very occasionally just to see how strong your muscles are, but it can actually cause infections and it can cause you to upset your continence mechanism. So we don't recommend you do it very often. And it doesn't actually really help you to strengthen those muscles. So it's that similar action, but away from the toilet. So general exercise is really important for anybody, and it's really important after you've had a baby. But it's about easing back into that exercise slowly. Now, earlier on I talked about taking nice short walks and gradually building that up on a daily basis or every other daily basis. So that's your starting point, and as you start to get stronger, you'll notice that you're able to do more. Now, you may be somebody who's been quite active before pregnancy and there were specific sports or exercises you did, and there's no reason why you can't get back to doing that, but there's certain timescales that we need to go on. So we recommend not doing anything too strenuous for that first 6 weeks. Once you get to that 6-week mark, you're able to do low impact exercise, so power walking, things like swimming, providing that your wound is healed. You may also do some sort of gentle cycling or some gentle stuff at the gym, the cross trainer. Anything high impact like running, contact sports, netball, football, badminton, anything like that, you need to wait until you get to that 3-month mark. Okay. If it's contact sport like rugby, something even more extreme, then you're looking at the 6-month mark. You've got to listen to your body. You may get to 6 weeks, but not actually feel ready to do low impact exercise. You may get to the 3 months and think, yeah, I can do a bit more high impact, but actually you've got to listen to that, your body, and see how you feel with that.